Hello and welcome to our channel. In today's video, we're going to be discussing the communication differences that individuals with autism spectrum disorder, or ASD, may experience. Even verbally fluent individuals with ASD have unique methods of communication, and it's important to understand these differences and how we can accommodate them. So let's take a look at some of the most common autism communication differences and strategies that can help ease frustration. Common autism communication strategies. Nonverbal communication. Many people affected by ASD develop little in the way of language skills and rely instead on nonverbal communication techniques. These include gestures, pictures or drawings, crying and other emotive sounds, and physically directing someone's hand to an object they want. While this can cause communication difficulties, parents and caregivers often become quite adept at reading these non-linguistic communications through context clues and repetition. Verbal communication. Some individuals with autism have challenges using verbal language to communicate. They might have communication disorders like echolalia or aphasia. Echolalia refers to the repetition of phrases that people have heard, perhaps in a favorite movie or television program. These phrases may or may not fit the context in which they are spoken. It's important to understand what the child may be trying to communicate when they use particular phrases. Use of behavior to communicate. Behavior is a form of communication, whether or not we are aware of it. A child without the ability to verbally express their thoughts and opinions may need to resort to using their behavior to communicate. A child may express displeasure with a situation by throwing items or engaging in tantrum behavior. It's important to teach children appropriate behaviors to use to indicate their feelings or needs. ASD Communication Challenges. Individuals with ASD typically have trouble understanding idiomatic language and metaphors. One of the best ways to accommodate this communication style is to speak in simple, plain sentences. An autistic individual's mind moves very quickly and processes many stimuli. Their thoughts may seem disorganized or unfocused, but unless an ASD individual has expressed the desire to stop talking about a given topic, they're usually open to revisiting previous conversation topics. Speaking with limited eye contact. One of the most noticeable autistic communication challenges is the avoidance of eye contact when communicating. People affected by this condition are highly attuned to sensory details, and looking into someone's eyes can cause an overload of information. Some may prefer to speak with their eyes shut entirely, so as to focus only on the stimuli provided by the conversation. Autism communication strategies that work. Visual supports. Visual supports are autism communication tools that can help build language skills. Individuals can use symbols, words, or even photos to communicate. One of the most widely used visuals is the picture exchange communication system. Over time, a child may learn to build sentences or answer questions using these images. Augmentative communication devices. Augmentative communication devices are high or low-tech devices that can replace or help develop speech. High-tech devices include smartphones or tablets that can generate speech using images or pre-recorded words and phrases. Sign language. When verbal language isn't possible, autism communication strategies like sign language can be useful. Sign language allows for more natural and spontaneous communication. There is some research that indicates that using sign language along with speech therapy can help facilitate language development in children with autism spectrum disorders. Conclusion. In conclusion, it's important to understand the communication differences that individuals with autism spectrum disorder may experience. Understanding and accommodating these differences can help build better communication with ASD individuals. nonverbal communication, challenges with idiomatic language and metaphors, and limited eye contact are all aspects that may affect autistic communication. Visual supports, augmentative communication devices, and sign language are just a few of the strategies that can help individuals with autism communicate.